In this video, we're going to talk about cardioversion for AFib. Who should have cardioversion, who should not, and what are the risks and benefits? For those who pursue a rhythm control strategy for AFib, which means that their treatment plan is to stay in regular or sinus rhythm, there are three treatment options. Number one, cardioversion. Number two, medication. And number three, ablation or surgery. In this video, we're going to talk about cardioversion. Cardioversion for AFib is a medical procedure usually done when the patient is sedated, where an electrical shock is applied to the heart to attempt to convert or change AFib into regular or sinus rhythm. More rarely, cardioversion can be done with medications. Cardioversion is used in patients with symptoms from AFib who are following a rhythm control strategy. Cardioversion can be done with or without AFib medications. Some patients are not good candidates for cardioversion. These include situations where cardioversion may be dangerous, like when there is a blood clot in the heart, or when it is not safe to take blood thinners, although exceptions are sometimes made if the AFib is under 48 hours in duration, or the patient has no stroke risk factors. Or when cardioversion is unlikely to be successful, such as those with permanent AFib, particularly if the left atrium is severely enlarged, have failed prior cardioversion attempts, have an underlying medical issue that is not resolved like infection or high thyroid levels. The initial success of cardioversion, which is achieving sinus rhythm, is usually high, about 90%. However, the risk of recurrent AFib in the weeks and months after the cardioversion is also high. Typically, cardioversion is done after the patient is adequately sedated. Often, a transesophageal echocardiogram, or TEE, is done before cardioversion to rule out a blood clot in the heart. This is called a thrombus in the left atrial appendage. Blood thinner medication is given before and after the cardioversion in most, but not all cases. Complications from cardioversion are uncommon. The most worrisome side effect is stroke, but in the setting of appropriate blood thinner use, this is exceedingly rare. Heart rhythm problems can also occur immediately after cardioversion, although these are usually easily treatable. In preparation for cardioversion, your doctor will usually ask that you not eat or drink anything for 8 hours before the procedure. Be sure and ask about taking your medications. When the procedure is done, you will be monitored for some time and usually go home the same day. You will need someone to drive you if you have received sedation. Cardioversion can be part of a rhythm control strategy for AFib. It has a high success rate and a low complication rate. Talk to your doctor if you have questions about cardioversion for your AFib. This information is for educational purposes only and is not medical advice. Don't make any decisions about your medical treatment without first talking to your doctor. Thanks for watching, and if you want to learn more about living a long, healthy life you love, click the link below to learn more about how we help people increase their health span. And if you like this video, hit the like button below, share it with your friends, and be sure to hit the bell and subscribe.